75-year-old woman presents with sudden loss of vision. She says that she was reading when she suddenly was not able to see the print on half of the page. Her symptoms started 4 hours ago and are accompanied by severe posterior headache. Vital signs reveal the following: temperature 119/76, pulse 89, oxygen saturation 98% on room. Patient is unable to recognize her niece when she arrives to see her. Non-contrast CT scan of the head shows no evidence of hemorrhagic stroke. What is the most likely diagnosis in this patient? Middle cerebral artery stroke, vertebrobasilar stroke, subarachnoid hemorrhage, lacunar stroke, or posterior cerebral artery stroke. Now, these lesions depends on where the clot is. So if it's more proximal, that's going to lead to more damage than a distal clot. Makes sense, right? This patient most likely had a distal clot, mainly supplying the occipital lobe, and that's why this patient is not having any midbrain issue or any thalamus issue, because posterior cerebral artery also supplies part of your. And if you remember the anatomy, if you remember your circle of Willis, posterior cerebral arteries are kind of the end branches of your basilar artery. They are part of your posterior circulation of the brain. Treatment is going to be same as the rest of the ischemic stroke, as I mentioned before. Rule out hemorrhage first. If they are within that 3.5 hour period, give them TPA. No TPA, go for surgery. Start them on antiplatelet therapy. The other options, we have the middle cerebral artery stroke. As I mentioned over here, middle cerebral supplies your lateral part. Patient are going to have contralateral total sight loss over the other side. Both sensory, motor as well, depending on which side is affected, patient can have either aphasia versus hemianopia or apraxia, right? So that is your middle cerebral artery stroke. Nothing to do with your vision. But they may have homonymous hemianopsia with macular sparing, because your macula is supplied by both your middle and your posterior cerebral artery. Even posterior cerebral artery stroke would also cause, they will have homonymous hemianopsia. Next one is your vertebrobasilar stroke. This one is going to involve your vertebropatellar artery. Vertebral and your basilar artery, they are kind of your posterior circulation of your circle of Willis. I would recommend you draw circle of Willis by yourself. Remember what branches come from where. If you put that whole circle of Willis into the brain, you will also be able to remember which artery supplies which areas of the brain, and that is easy. Now, the vertebrobasilar stroke, since it involves your posterior circulation, depending on where it supplies, that's where the lesion is. And it is a major stroke. If you remember, vertebrobasilar artery has a lot of branches. It supplies your occipital lobe. It can cause loss of vision like what this patient had. It can also include the brain stem, right? Pontine arteries come from basilar artery. Your anterior inferior cerebellar, posterior inferior cerebellar, your cerebellum is affected. It can cause ataxia, not seen in this patient. It can cause pontine issues, right? Pons being involved because of pontine arteries. And so your cranial nerves can get involved, but not seen in this patient. And that's why, just because the patient has sudden loss, your vertebrobasilar stroke is kind of too huge for this particular patient, right? And that's why they are being specific to the posterior cerebral artery stroke. Subarachnoid hemorrhage is bleeding into the CSF, as the name implies, subarachnoid. Below arachnoid, and below arachnoid is your CSF, right? Your cerebrospinal fluid. That one is also going to present with a sudden headache. They're going to describe it as a thunderclap headache or the worst headache of their life. Usually it is associated with a trauma or an aneurysm or an AV malformations, right? But your CT scan would show bleeding already, and this non-contrast it already ruled out the hemorrhage, right? Lacunar stroke, they are kind of very, they're deep stroke, basically, including maybe a basal ganglia, your coronary area kind of structures, and they are the smaller subclinical branches of your MCA, and it applies those deep structures like internal capsule and basal ganglia and all that. Usually, chronic hypertension is what would involve and what would cause lacunar stroke.
Thanks for watching. Please give a thumbs up and subscribe for more.